If you've ever lived through a traumatic event, you know it can cause anxiety, fear, stress, even feelings of hopelessness for months, even years afterward. Dr. Jeremy Burd from Cottonwood Springs is here to talk us through PTSD. Dr. Burd, this is a really difficult disorder. It's difficult to pin down and identify. What exactly is it?
So PTSD stands for post-traumatic stress disorder, and it's a type of anxiety disorder that I think we usually associate with combat veterans. And there's an obvious cause of a trauma, but it's something that's much more pervasive than people that are just in war. So it can happen to children that are terrified of their parents who maybe even just yelling and screaming. They could take those memories, those experiences with them the rest of their lives, and then whenever they get into a situation where there's someone yelling or screaming, they're suddenly like they're 5 again. And of course there's more severe things that can happen to kids that affect them really throughout their lives and with relationships. So it's something we see a lot at the hospital.
Any form of abuse or trauma from children to adult, I would imagine, can cause PTSD as well.
Yeah, abuse is a big one. And as much as we've become more aware of abuse, it seems that people that are abused tend to find ways to deal with it. They're trying to survive. So if they're abused by a neighbor and they go and tell their parent, and the parent takes it seriously and gets the police involved, and something happens to the perpetrator, that kid has a much better chance than I have a patient that her mother slapped her when she told her mom that the neighbor boy had done something very inappropriate with her. And she spent the next 30 years thinking she was bad. And she finally came into treatment and she's got depression. But when we figured out, well, why aren't these medications working? It's because she has this script going in her head that bad things happen and it's all her fault. And so it really is something that medication alone won't treat. And that's something that we've been able to do at Cottonwood Springs by having groups, by having talk therapy. We can get at the roots of what causes the depression, which is often trauma.
Yeah, because depression can sometimes be a chemical imbalance, but when it's caused by a trauma, there's so many layers to that onion. So you, at Cottonwood, you peel back the layers of the onion and figure out the source. It can also be, as we were talking before we came on air, if you witness something traumatic, you witness a horrible accident or you witness something, it can impact you. What are the signs? Because there are people watching right now that have PTSD or they know someone with PTSD and they might not even know it. What do you look for?
So it usually happens within it's normal to have a reaction to a trauma, but what's unusual is months and months after the trauma to continue having symptoms. And so they sort of go a little bit like, you'll have nightmares of the event that happened. You'll have flashbacks while you're awake. Suddenly you feel like you're back in that same situation. People tend to be more jumpy, more anxious just in general than they were before.
Social anxiety?
Social anxiety, their heart rate goes a little bit faster. Their blood pressure's up, they're sweating. I mean, all sorts of things that you might associate with a fight or flight response, but that are happening at times that it's not appropriate.
And then you talk about the more subtle symptoms like feeling unable to connect or detached from people. So
being able to relate to others requires trust. And so people that have been traumatized have had their trust mechanism breached. And so it's very hard for them to just warm up to anybody. And that makes it harder as a therapist too, because you're trying to establish a relationship and they're saying, I'm used to people that cared for me not showing that. So it takes a lot of work, but usually people, deep down, they know something is wrong. And if they're told that's not true, they start thinking they're crazy. And what's really cool is we get to show people sometimes, hey, you're not crazy. You're actually, what you're feeling is correct. And suddenly things like the depression start to go away, because they learn to trust their own instincts about what's best to protect themselves.
You're never crazy. Your feelings are your feelings, and it's important to deal with that and tell someone if you need help. Dr. Burd, thank you so much.
My pleasure.
A really good topic. Cottonwood Springs is on South Arapahoe Drive in Olathe. If you would like a free 24/7 assessment, hey, what harm could it do to get a free assessment? Call 913-353-3000 or visit cottonwoodsprings.com. Thank you so much.
Thanks.
Rob?
Thank you, Alexa.